Hello, and welcome to Capital Health Plan's colon screening program. The purpose of this short video is to give you some idea of what to expect during your colon exam. However, if you have questions after watching this video, make sure to ask the nurse or the healthcare professional for more information before proceeding with the exam. Colon cancer screening is very important, and at Capital Health Plan, we want you to be as comfortable and as informed as possible. A lower endoscopy is a look at the inside of the large intestines, also known as the colon or bowel, with a lighted tube called a scope or endoscope. There are two types of internal colon exams that are done with a scope: a flexible sigmoidoscopy, more commonly called a flex sig, and a colonoscopy. To understand how a colon exam is done, it is important to look at how the digestive tract works. After food is passed through the stomach and small intestine, it moves into the colon and finally into the lower portion of the colon, which is called the sigmoid colon and rectum. One question that is often asked is it painful? Colon exams are not intended to be painful, but you may expect to feel some cramping, bloating, and pressure. People differ on how much discomfort or unpleasantness they experience. Some report none, and others more, but most people find the exam tolerable. You may have heard that some people have the exam done with IV sedation, but studies show that this is not necessary. We will communicate with you throughout the procedure and make any necessary adjustments so that you are as comfortable as possible. Before your appointment, you will have done a bowel preparation, which is extremely important so that the lining of the bowel is clear of debris so you can get the best exam possible. The reasons for the prep are simple. The scope cannot see through stool, so if your bowel is not adequately clean, the exam could be less than optimal or possibly can't be completed. For the exam, you'll start by laying on your left side. Then you'll have a rectal exam with an examining glove, and then the tip of the scope is gently inserted into the rectum. The scope is slender and holds bundles of extremely thin fiber optics to light and view the inside of the colon. With the controls on the scope, the tube can be turned in any direction to aid in the bowel examination. Since an empty bowel is flat, a flow of air inflates the bowel during the procedure and keeps the colon open for clear viewing while the tube is carefully and slowly guided through the bowel. It is very normal to feel bloated and to have a full sensation, as if you need to move your bowels. During the exam, since air is being put into the colon, some people have the need to pass that air. That is not unusual, and it's an expected part of the test and should cause you no embarrassment. The lining of the colon will be checked for inflammation, abnormal growths, diverticulosis, and potential sources of bleeding. During the exam, you may be asked to turn on your back or on your right side, which can make the tube pass more easily through parts of the colon. It is common to change positions during the exam, and we will let you know if this becomes necessary. Sometimes biopsies are done to remove samples of tissue from the colon. Since the colon lining doesn't have pain receptors, taking a tissue sample is painless. Very few people report sensing a slight tugging sensation when a biopsy is done, but there is no pain. If tissue is biopsied, it doesn't mean that something is wrong or that cancer is suspected. For example, a sample may be taken if the lining looks irritated or inflamed. If any growths are found, they can be biopsied and partially or completely removed for further testing. If a biopsy is done, most of the time the tissue is completely benign. But the tissue will be sent to the lab because looking under a microscope is the only way to differentiate between normal tissue and abnormal tissue. You will know the preliminary results of your exam as soon as your exam is completed. But if tissue is biopsied, the results will not be available immediately. After the tissue is processed in the lab, which generally takes several days, you will be informed of the results and will be told if there is any follow-up necessary. Having a colon exam is a safe procedure, and unexpected events or complications are rare, but they may occur. For instance, biopsies may be done, which can result in unexpected bleeding. There is a small chance of having a puncture in the colon called a perforation, which may require surgical repair. Since the colon is not straight and there are natural bends and folds, there is a chance of missing a lesion. But to avoid this, time will be taken to get the best view possible. You will be monitored closely during your exam, and care will be taken to minimize your risks so that the procedure can be done as safely and as comfortably as possible. After the procedure is completed today, you may experience some residual bloating, and you may feel full or distended, which will resolve within a few hours. You can resume your normal diet as soon as you would like, even if you have had biopsies. If you have taken pre-medication for anxiety or discomfort, after the procedure you should rest for the remainder of the day. You should not drive or operate machinery. You should not return to work or participate in physical activities or do anything that requires judgment until tomorrow. If you have not taken pre-medication, you can resume your usual activities immediately after the procedure. If you develop symptoms, for example, severe abdominal pain other than gas pains, a distended or firm abdomen, excessive bleeding, fever, or abdominal tenderness, you should immediately call our office or your primary care physician or seek out emergency care. Everyone who is 45 to 75 years old should be involved in routine colon cancer screening, and some people should continue through age 85. Having a colon exam is very safe, effective, well tolerated, and could potentially save your life. You still have a choice of whether or not to have an exam today, but the benefits do outweigh the risks.